No sound from Greg.
Thanks, Peggy. Welcome, everybody. Didn't realize I had. Go ahead, Robert.
Hi, Greg.
Hey, how are you?
Good. I have a good story to tell about a client, and then I have 3 questions about 3 different clients.
Okay, fire away.
So a couple weeks ago, I saw a woman for the first time for a session, and her primary concern was pain in her hips. And it had been going on for a number of years, and I've known her for about half that number of years, and she finally decided to come in for a session. And so I had Digestive Calm handy. We put it on her abs. She did it, took some home. She's put some more on. The pain's gone away completely.
Oh, good.
Like in about 3 applications.
So like just to like talk that out a little bit. God, I love that.
Well, last week I asked, or 2 weeks ago, I asked the question about hip pain, and you gave me a whole list of things. So we put her on that now.
Oh, good.
So that's in progress. She's been on it for about a week now.
Oh, tremendous.
Yeah.
So it was in her hips, though. It wasn't in her low back. It was her hips.
She felt the pain in her hips, but as soon as we relaxed her gut, the hip pain went away completely.
Nice.
Yeah.
Yeah, I mean, some of that with the Digestive Calm, it does relax the psoas a bit, which is the hip flexor that goes from the lumbar spine down through the pelvis and then attaches to the upper thigh. You know, it's the strongest hip flexor, so it makes your the leg come up. And a lot of times when there's hip issues, the joints, the muscles around the joint start to split. And one of the ones that really tightens up is the psoas. And
So I think it's really positive. So I have 3 clients that I have questions about. First one's a woman, 60 years old. About 6 months ago, 6 or 8 months ago, she started having pain in her right knee. She went and saw the doctor, and they did some x-rays and tests, and they basically said she's bone on bone.
Okay.
What can we do?
So I mean, you're basically managing a situation that, you know, whenever she's moving it, she's going to be irritating it because it is bone on bone. There is no lubrication or, you know, padding / lubrication. And so, you know, they are making strides with like certain kinds of injections and things. And so if you can keep her comfortable, you know, if she pursues that, she might find some relief from that. But as far as, you know, old school way of looking at it, you're not able to make the cartilage grow again because it's not something that has its own blood supply. It's a lot like your fingernails or your teeth or something like that. And so, really what you're doing is you're trying to increase blood flow to the area. You're trying to keep the lymphatic function happening as well as you can, and reducing spasms in the area. You know, there's always potential issues with like inflammation and the joint capsule getting inflamed and tendonitis and things like that. And that stuff you can kind of troubleshoot, but the 3 big ones are lymphatic movement, blood flow, and the movement of lymph in the area. You know, because it's bone on bone, there's going to be constant material that needs to be cleaned out of that joint. And, you know, you're wanting to keep blood going to that area just to keep it as comfortable as possible. You know, if there was still a little bit of cartilage left, the increased blood flow would help to like save that cartilage. But when they're bone on bone, it's still about keeping the bone and that joint as healthy as possible and getting blood to the area. But you're really wanting to just keep her as comfortable as possible. She's going to have more issues with more movement, especially weight bearing movement. And so her exercise, like if possible, things that are potentially like non-weight bearing, like, things in a pool. I mean, like getting on an exercise bike can be okay, but even the repetitive motion, if you're doing like 70, 80 revolutions per minute, that can actually even be somewhat aggravating to it. And so
she's a golfer, and her measurement of how good of shape she's in is if she can play this one particular course all the way.
mhm. Okay.
So
Yeah, I mean, just keep her as comfortable as possible. Like, so again, going to the joint relief, something that's lymphatic in nature. Um, the lymphatic blend, chocolate root cleanser is also a very good lymphatic stimulant. Even the pepper, any sort of pepper will keep the circulation going and help to move the lymph through the area. And the joint relief will increase blood flow and reduce spasms. And then you can augment it with things that are antispasmodic. And the one that I kind of like to use, you can go marjoram, you can go things of that nature, but you could also in this particular area, you could use like basil or petitgrain, or there's that blend spasmophilia, and you're getting a couple things here. You're getting a physical component and you're getting an energetic component. And the physical component is they're also very antispasmodic. The blend joint relief has some antispasmodic properties, but sometimes you need to augment that a little bit more. And so the basil and the petitgrain are very good for reducing some of that. But the thing that it does really well is it helps to unwind like those inner health rays. There's the outer health rays and inner health rays. And, so there are just this lines of energy that continue from the pores of the skin inward. And the more that you can kind of keep that unwound, the more like energy or life force can get to it. And it just keeps everything as functional as possible. Like, any sort of arthritic condition, you're really dealing with a lot of depletion in that part of the body, not necessarily the whole body, but it definitely in that part. And so by opening up those health rays, you're getting more energy flowing through that joint than you would otherwise. So you're kind of getting a couple of different things happening there, where if it was just like a sprain or a strain, I'd say, go marjoram, go, do just a bread and butter oil, like with something like that, and it should knock it out. But here I'd probably switch over to like basil or petitgrain or something of that nature. And she sounds like she's still pretty active.
yes.
One thing that like we don't ever really talk about a whole lot in a situation like this is also to treat the skin over the area to still stimulate lymphatic movement in the skin itself, because the skin can be a reflection of poor lymphatic movement, down deeper. And anytime you stimulate lymphatic function in the skin, it actually stimulates the organs of blood purification, which is really kind of critical in arthritic conditions. So it will stimulate, the kidneys, the liver, the spleen, the lungs. And so, you can use things like coffee, you could use parsley, you could use celery, carrot, any of the ones that are real good skin cleansers. It wouldn't be like the top thing on my list to do. Like those other ones are much bigger, like fish to fry, so to speak.
Okay.
But when you're really looking at like long-term treatment, keep in mind that you want to keep the skin in that area as healthy as possible.
Okay.
It's not so much like, oh, it's getting eczema, or oh, it's getting, a rash or something. You're really looking at how well is the skin in that area detoxifying? Because if it's toxic on the surface, it's going to have fascial restrictions and poor lymphatic movement down below. And so you stimulate the stuff the way that we talked about, but if the skin is real congested in that area, it makes it harder and harder to treat over a period of time. And one of the ones that's really good for skin congestion is helichrysum. Helichrysum can be quite good in this. So even the use of like lavender just by itself can be kind of helpful for like the spasms and the energetic component. And lavender does have some properties that are good for like spasms and pain relief. It's not the top pain reliever, but it does reduce some nervous tension. And in a situation where a joint is compromised, the nervous system in that area tends to get a little bit like aggravated, you could say, and like overstimulated. And so, yeah, I would keep that in the mix. And, as long as she's staying active, I mean, I'd keep treating it. It will need to be treated consistently. I would say treat it before it becomes a problem, because at some point when you have a joint issue, if you just keep waiting till there's a fire, at some point you're not really able to put the fire out, and that inflammation and that inflammatory material becomes systemic. Like it just starts to travel throughout the whole body. And if you stay on top of it, especially with her active lifestyle, she'll know when it starts to flare up a little bit, like, maybe I should stay off of it for a few days. And, rest would be important, but, if she's playing golf and everything, like definitely have her see the doctor as well.
Right.
And, there are these new shots and things that they're doing. And, things now there's a lot more potential for her to like avoid a surgery now than say 5 years ago, especially like 20 years ago. 20 years ago, this would just be surgical. But these days, I mean, it still might come down to that, but you can keep her relatively active as long as she doesn't overdo it.
So going back to the first set, the joint relief, how would you apply that?
With that, I would probably put it on with like some sort of base oil. Like I like sesame for this, because sesame by itself is a lymphatic stimulant, just with no essential oil in it. And so when you're looking at things like joint issues or muscular issues, or you're trying to detoxify the body, putting essential oils in sesame oil is significantly more therapeutic than just say, like a almond oil or a grapeseed oil or something like that. And so I like to go sesame oil with this, but other things will work, but sesame oil is, it's not expensive unless you get the really fancy stuff, and it's a lot of bang for your buck. And I mean, sesame oil is almost as therapeutic as the essential oils themselves. And so to combine the two makes it an even more potent ointment. Yeah.
Okay. And then you talked about basil, petitgrin, spasmophilia, marjoram. How will we do those?
You could put it on like with alcohol or witch hazel.
Okay. So like a body tonic.
Yeah, body tonic, liniment, whatever version of that you would want to do. That way you can actually put that on, let it dry, and then put the ointment on top of it. And you really wouldn't have to have very much time in between the two. You could just put it on, let it dry, put the ointment on, boom, you're kind of good. Okay.
And then helichrysum, again.
I would rotate that. Yeah, I would rotate that from like maybe once or twice a week. Like it probably doesn't need to be that much unless it's helping her with some pain management, which is always possible. But for the skin, I'd just say like once or twice a week. And that one, it doesn't kind of matter how you put it on. It could be a liniment, a body tonic, a massage oil, even a little bit just neat, like any of that would. Yeah.
So how would Lovage body tonic do in this?
Yeah, lovage is very good for cleaning up the inflammatory material. And so I would treat probably the whole leg with it other than just the knee. Like the issue with anything that's bone on bone, a little bit in the spine, but more like hips and knees, it's generating a lot of inflammatory material that goes through the body. So by putting the lovage on, you're helping to clean up the soft tissue of that inflammatory material. And lovage is also a little bit of a diuretic, so it increases the urination and the quantity of how much you would urinate. And in arthritic conditions, you're wanting to reduce the amount of deposits that would be like uric acid, lactic acid, crystalline deposits, things like that into the joints, because that is part of the arthritic, issue. That is part of the arthritic condition. And so augmenting with things like lovage and things like that, very, very helpful. Yeah.
Okay. So moving on to the next client, he's about 75. He has what he describes as wart-like bumps on his arms, legs, and ears. They're always present. They don't come and go. He doesn't know what triggered them. And I sort of asked him, he doesn't have a I haven't seen him, so I can't tell you that. He describes it as like eczema or dry skin or aged skin. And then there's also some info. He bruises very easily, has always done that his whole life.
Does he have anything like asthma or anything like that?
Not that I know of.
And you say the bruisings happen for a very long time.
The bruisings happened his whole life. He said his mom had it too.
I mean, there are kind of genetics that can play a role in something like that. Anytime I see bruising that's real easy or spontaneous bruising, I mean, that always can be a more serious health issue, for one, but that he's had it all his life, I rule that out.
Yeah.
But for me, I usually go, to vitamin C, like a vitamin C deficiency. And sometimes people's bodies will use up vitamin C much faster than somebody else. And so I always like to go quercetin with something like that. Like this, you probably could get away with just doing straight vitamin C, but like 2 or 3 times a day, just constant, and then try to augment with foods that are high in vitamin C. That should, in theory, slow down the bruising. Like if there's a genetic predisposition, I mean, I've had some patients that were like that, and we couldn't slow it down very much. Most people, like 80 or 90% of the time, or even 95, the vitamin C will improve it. Every once in a while, it might be an iron deficiency. But the thing that I would also look was like if you go and look at their skin, the thing that you want to look and see, there'll be like the size of the head of a pin. There'll be these little red dots. They're not everywhere, but like if you look on the arm, for example, like if you look on the forearm and you just kind of look at the skin for a little bit, you might see a couple of them. And I mean, you don't have to search super hard. I mean, they're obvious that they're not like brown or black or a freckle. I mean, they're red.
Okay.
That's a vitamin C issue. Like they're not getting nowhere near enough vitamin C. And so, the other thing that I'd check is, check to see if he's diabetic. And if so, that could be a reason for the increased need for vitamin C as well.
But, I don't believe he is.
Okay, good.
But I'll check.
So, yeah, I mean, it's always nice to cross it off the list.
Right.
And so, regardless, I would kind of go through and checking for that. So there's the bruising, and what was the other issue?
The bumps on his arms, legs, and ears. eczema,
And-
dry skin is
Yeah.
what he calls it. The doctors have
Okay.
given him an ointment, but it hasn't worked, and they haven't told him what their diagnosis is.
Skin issues, sometimes they just treat, they don't even give it a diagnosis. I mean, it's it's that old thing where if it's hot, you cool it down. If it's cool, you warm it up. If it's dry, you moisten it. And if it's moist, you dry it out. Like, a lot of times with skin issues, they kind of do things like that. I would probably start with, you have some kind of choices here. One would be Kunzia, right? Very good for eczema type situations. Kunzia could work. Palmarosa could work, especially if the issue is like a weeping kind of eczema, where there's like moisture or a little bit
There's
of
no
fluid.
moisture. It's
No
dry.
moisture. I'd probably go back to Kunzia then.
Okay.
Palmarosa will work either way. Even lavender will work for this sometimes, not every time, but you're probably going to have to experiment to see what's going to work. You can put it on with an ointment. With these, I like to do it in either like with a little bit of witch hazel, but like sometimes what I do is mix it in with some aloe vera gel. Like, put like a bunch of drops in the aloe vera gel and stir it up, and then have them like in a little Tupperware thing, and then just have them rub it on an area. And it's kind of moistening, and it keeps it real superficial on the skin rather than super penetrating like it would be with alcohol. And it's just soothing for things that are inflamed. And so you could try that, and we're just going to have to treat and see what works.
Okay.
Zea with like eczema type things. Now, like I thought you said like it was kind of wart-like. What
He
did you say?
described it, yeah, he described it as wart-like bumps, but he also described it as eczema and dry skin.
The wart-like stuff I would treat with thuja, definitely with thuja. Yeah, if it is a wart-like thing,
Like
sometimes
skin
people get, sometimes people get these things that it's actually the walls of the intestines like kind of leak a little bit, and they'll get these like pieces of material from the digestive tract will end up in the blood, and then there'll be like these little cyst things all over their body. And they're just like these little bumps, and they'll be all over their arms and legs. I mean, not like crazy tons of them, but like, 4 or 5 on the arm, 4 or 5, or 6 on the arm, maybe 7 or 8 on the legs. And those are hard to treat individually. You almost have to go to the gut, but the ones that are already there, they're hard to get rid of. They've already had like a little cyst form around it. They've become like a little cyst, and those cysts can be hard to break up. Let's see what it looks like when you see him in person, and then kind of from there. Yeah, that's what I would do. Like here we're kind of doing like a little bit of hearsay and what he's describing. One of the things that you could do is, when you see him, take a picture of it, and then you and I can look at it, and we can kind of figure it out from there.
Okay, I can do that.
Yeah, perfect.
So the third client is more of an acute situation. She's 55. She recently had COVID. She tested positive for 11 days. She's now testing negative, has been negative for about almost 10 days now.
Okay.
She's a voice artist, and her voice is currently dry and scratchy, and has been for most of probably the last 15 to 20 days. And I saw her earlier today, and her voice was definitely dry and scratchy. We did the first part of the regenerating the immune system. So like the beginning of the lymphatic stuff. And her voice changed dramatically in an hour and 15 minutes.
Oh, tremendous.
To me, that would be like carry on with more of the lymphatic stuff, but I'm sure
I would probably do that. Like, so If she's responding already with lymphatic work, I mean, you know, any time you detoxify the body, it's a good thing. Sometimes it's a little slow to reduce some of the symptoms, but in this case, if she's already starting to have some symptoms reduce, that's great. A couple of things that I would add, and I would do them kind of in this order. One is you could have her inhale a few times a day. You know, she could even do more if she wanted, but at least like 2 or 3 times a day, like cinnamon or cassia. And the issue is like it will help strengthen the body, but cinnamon especially is an overall body stimulant, and it helps to like generate moisture in the mucous membranes. It helps to moisturize the eyes. It helps to, you know, just get stuff moving in the body. Like it just makes everything start moving and stimulate everything. And I think sometimes with these post-COVID issues is some of the body has become a bit stagnant and isn't quite functioning up to par, up to speed. And in the old days, we used to give them like this a long time ago. I would give them like big dosages of cayenne pepper, like, you know, the tincture. It's not a comfortable process, but it does work. The easier version is just to sit and inhale cinnamon. Like, you know,
Okay.
it works almost as well without the burning throat and the burning gut. You know, the cayenne pepper is a little bit hard on the throat and the gut. But if you have her inhale that for a period of time, within a couple of days, that should improve. Then if she's still kind of a little sluggish in that area, I'd go to the Schizandra. You know, Schizandra helps to moisten the mucous membranes from like kind of the inside out. It helps the body like convert water to something that's usable. Like sometimes we take in a bunch of water, but because of what's going on in the body, it just kind of passes through the body or gets dumped into tissue and it's not getting properly utilized. And the Schizandra helps with that conversion, so it helps to moisten everything. I suspect the cinnamon is probably going to be the thing that helps. You know, between that and the lymphatic work, that should help to knock it out. But if she still needs a little something, you know, it's very fortifying. It will help her with her sleep and help to moisten the mucous membranes.
Okay. So just to confirm on the cinnamon cassia, not in the evening because it's too stimulating.
Yeah, probably not a couple hours before sleep.
Okay.
Like, you know, if it was like 5 or 6 o'clock, she could kind of still do it, but I would do it morning, afternoon, late afternoon, and then in the evening, just let the body be tired and go to bed.
Okay. And on the Schizandra, 2 drops internal?
Yeah.
Okay.
Yeah.
Cool.
And if she did that right before bed, it would help her sleep.
Okay. Good time. Okay, wonderful. That's awesome. Thank you very much, Greg.
Yes, yeah, good talking with you.
And then go ahead, Ralph, then Peggy.
Hey, Ralph.
Hey Greg, how you doing?
How are you?
Well, I was doing pretty good till I went and saw the dermatologist.
Mhm.
And she did a real good liquid nitrogen burn on my face.
Okay.
So I've been putting, I'm immediately started treating it like it was an open wound and put helichrysum on it.
Okay.
What else might be?
So they burned it for potential precancerous things. Let's see. Okay.
But now it's burned brown.
Okay. So I couldn't hear what you said, but I got to see your picture there. So okay. So what were you saying?
She didn't say cancer. She said lesion.
Okay. I would say probably helichrysum is your best bet. I don't know that you need to add anything else, like maybe a little bit after everything kind of closes up and the inflammation goes down. I'd maybe do like some scrubs on your face with parsley.
Mhm.
just to kind of keep cleaning up the skin.
Yeah,
But helichrysum is a pretty solid choice in this particular area.
okay,
Yeah.
all right.
I mean, it's good for the skin, it's good for the wound, it's good for the inflammation, it's good for the pain. You know,
Mhm.
it's like it's kind of hitting all the points. That she said lesion. I mean, did you have periods where you're out in the sun quite a bit when you were younger?
Yeah, probably. And I hated wearing hats as a kid.
Yeah. Um, Give me just a sec here.
Sure.
Yeah, mm, you know what I would use? I would use both as like a scrub and even mixing it with like a little bit of oil or aloe vera is opopanox.
Okay.
And much less expensive than myrrh, so you could go a little crazy with it. You know, it's probably like a third the price,
Okay.
and very similar to myrrh. Like
Mhm.
myrrh would be like probably another one, but like I think you can just do it with the opopanox.
Mhm.
And I like it for a couple of reasons. Like, it would be good for the skin. It would be good for the exposure to the sun back from your youth,
Mhm.
and it's also good for stimulating the parasympathetic state for healing particular issues,
Okay.
and it's also calming and soothing to the limbic system, and sometimes when you get like potential for growths and things like that,
Mhm.
you know, I'd like to target the limbic system somewhat. And
Okay.
you know, if it's like it's already like been, you know, cut out or something like that, like I don't really worry about it too much. But when you're looking at like the potential for growth over the next 5, 10 years or whatever, calming down limbic function is always good. So things that are good for that, myrrh, opopanox, like galbanum, palo santo, you know, things of that nature are all kind of calming and soothing to the limbic functions,
Mhm.
and um, they They don't knock it out, but they slow down the potentials for chaotic cell growth. You know, so this would be any sort of lesion or cyst or, you know, like growth. And if it's already in motion, that's one thing. But here we're kind of trying to do like a little bit of a preventative thing.
Yeah.
And I kind of like that idea of treating lymphatic function.
Okay.
There is like, so I would use those topical, like if you wanted to use something internal, you could still use the Opopanox or myrrh or galbanum internally,
Yeah.
2-3, 1 to 2 times a day. And then also there's that blend. I can't remember if it was already in a class or it's coming up, but the monk's anointing oil, is that?
Monk's anointing oil was in last week's class, I know
Okay,
for sure.
yeah.
And
So the
that's
monk's
different.
anointing oil is, you know, it's a bunch of oils that, you know, it's an old anointing formula, but they all target lymphatic or limbic function.
Okay.
So, yeah. So any version of that. Yeah. But for right now, topically, helichrysum is your go-to thing. Yeah, good instincts.
Okay, good.
Yeah. Yeah.
I'm also doing some pH sweeping on this. And right now I'm using light white green, LWG and LWV. Is there,
Heavier on the violet.
okay,
Yeah. Yeah.
okay,
Yeah. You can always put blue on, like, you know, like when you're done and you want to energize green with heavy on the blue and then a little violet as well, like green, blue, violet,
okay,
but heavy on the blue.
okay,
Yeah, like think of the blue as like it's going to slow down potential growths in the area. Like, so if
okay,
there's like a chaotic cell growth is something that's like agitated and growing at a chaotic rate or an agitated rate. So the blue has a very strong inhibiting effect on that potential.
okay,
Yeah. So more energizing than cleansing.
okay.
Yeah.
All right,
Yeah. And keep us posted.
all right, I will. Thank you.
Yourself.
Talk to you later.
And then go ahead, Peggy, then Linda.
Hey, Peggy.
Hello, hello, hello. Running around 74. I'm doing good. Our beautiful onks. I know what we did to clean the ceremonial bowls that were copper before a puja, but we had a member ask, how do I keep it, you know, shiny? And I said, you know, I don't want to, and mine too is it's getting the energy of using it all the time, I think. But what do you recommend for people? Should they do something to make them shiny again, or love them just the way they are? Or what is your take on that?
You can go through and shine them. I would just use like whatever, like copper cleaner or like a jewelry cleaner. Yeah.
We used to use salt.
No,
Jewelry cleaner. Okay, I can tell her that.
yeah, that's what I would. Salt would be more for the energetic component, but yeah, I've never used that for cleaning up the finish.
Okay. And I didn't know if you wanted me to share when Ralph was talking a little while ago. I had 15 places very recently burned or frozen, whatever terminology. And I don't know how you feel about Dr. Willard's water is a catalyst altered water, wetter than water, that it helps any kind of burns. And so one of the things I kept close to me was a spray bottle. When I had a broiler that blew in my face one time and took off my eyebrows and singed my hair. I had no eyelashes, and I kept the Willard water on my face all night. And the next morning people said, you don't look burned. And I said, no, but I don't have any eyelashes, eyebrows, or so for the purpose of the story is I kept a spray bottle of the Willard water, and it cools because the freezing really is a burning to the skin. So for me, that helped me. I used the oils you talked about, but I also sprayed my face intermittently with the Willard water to help cool the burning sensation of the spots. But I didn't know how you felt about me sharing one of those kind of unusual things. So
yeah, I don't know anything about it. So
yeah, that's why I figured.
Yeah.
But thank you, thank you, thank you. I'll share with our
Thank you.
member about the, thank
Okay.
you. I'm looking forward to the weekend. Yay.
Yeah.
Thank you again.
And then go ahead, Linda, then Kathy.
Hey, Linda.
Hey, Greg.
Hey,
How are you?
you good?
I feel like I see you every day because I work with the recorder. Anyway, I'm doing really well and I have a head cold. No, that I'm still doing really well. And I've been, looking at the lists and stuff, but so I just have a head cold and sinuses. It's not in my lungs. And I'm wondering
Okay.
what you recommend in terms of oils and protocols.
Yeah, so with and a lot of mucus, is that what's going on? Like a lot of mucus in this?
Yeah, but it's not terrible. It's not a terrible cold. It just, I'm blowing my nose a lot. Yeah.
Okay, so rosemary can be very helpful for the sinuses, like be it regular rosemary or rosemary verbena. It can be very good. Inhaling it can be good, and even taking a few drops in water internally can be very, very good.
Okay.
Can help really knock that out somewhat. Things like breaking up the mucus, like if you need to dry it up a little bit, you have a couple of choices. One would be terebinth. Terebinth is like a type of pine. It's actually the wood, not the
I don't
needles.
have
And
that.
so pine would work, but the terebinth would work better.
Okay.
Another one would be angelica, like inhaling a bunch of angelica or even
Okay.
taking a couple drops internal. If you don't have that, if you're just trying to dry it out, even some eucalyptuses can be
Okay.
good for something like that. I tend to like to go with like something. Do you have any sort of pine?
I probably do. I don't right now
Yeah.
have any rosemary, so I may need a substitute for rosemary too.
Okay, so if you don't have rosemary, do you have some basil?
Oh, I have lots of basil.
Yeah, why don't you just bump up and take 2-3 drops of basil 2-3 times a day, and
Okay.
even inhale it a bit. Like rosemary is pretty solid, but in this case, work with what you got, and basil's there. Now, look, if you also want to get something from the health food store, golden seal root. Like if you take 2 or 3 capsules a couple of times a day, that will clean up that mucus, and if there's infection, will also knock it out. So
Okay.
when there is a lot of mucus and a potential for an infection, with that I usually treat with oils and with golden seal, and it usually will knock it out kind of quickly.
Okay. Is
Yeah.
quercetin good for this kind of an inflammation?
It's not going to necessarily knock out the mucus. Like if it was allergy related, it would calm down the allergies, but it's not necessarily going to clean up the mucus and the the runny nose or the stuffy nose.
Okay.
And it can be helpful, but probably wouldn't be as helpful as you would like. You know what I mean?
Okay.
But if it was because of allergies, it would help like prevent it. But once you're there, excuse me, even if it's allergies and then it's full blown become like a stuffy nose, I still usually switch over to the golden seal and then use something like rosemary or basil or something.
With the
And
basil, could I also do the like the blood purification protocol with that?
you could do that. Do you have hyssop?
Oh yeah.
Okay, once you do hyssop and the sinus pattern, where you do the ajna, the throat, the bottom of the throat, the cheeks and the jaws, and then the back heart, front solar, back solar, the hyssop will help reduce some of the mucus and just help open everything up, and you might find some relief from that as well. I'd still do the basil, and if you have some pine, like do the pine. Like terebinth is what's traditionally been used, but I find that even other pines will work. But terebinth is very drying to mucus. You know, there's different ways of trying to address mucus. One is to expel it out, to break it down, and one is just to dry it out. And if it needs to be dried up, terebinth works. But if like the nose is running a lot, the angelica will stop it usually pretty quick.
Okay.
But so will golden seal. Like the golden
Okay.
seal will probably turn that off kind of quickly. Like if the
Okay.
nose is running all the time, you know, like sometimes your nose will just like turn into a faucet
Yeah,
and
yeah.
just like pouring out. Like angelica and or golden seal will usually knock
Okay.
that out.
And so
Yeah.
the basil, I'll do a couple drops twice a day internally, and then I'll use the hyssop's in the sinus powder. And Letty, thank you
Yeah.
for posting that for me. So I'll
Yeah.
pull that off the chat. Fabulous. Thank you.
Okay. Yeah. Keep us posted.
I will. By the way, my shingles healed really well and really quickly. That neem
Oh, good.
oil, oh my God,
Yeah.
that was the
Yeah.
best.
It's
Yeah.
amazing.
It is so amazing. It's
It's a-
stinky. It's
Oh,
not.
I don't mind the smell. It was great.
Oh,
It was great.
good for you. Like
Yeah,
I
thanks.
have a t-shirt that I used it on and I had to just throw the t-shirt
Oh
on.
yeah,
there. Ugh.
it does.
That t-shirt will never be the same.
Okay, thank you.
You're so welcome.
And Letty, would you mind posting that pattern to the whole group? I'm sure other people are curious as well. I appreciate that.
Thank you, Letty.
And then go ahead, Kathy, then Troy.
Hi.
Hey, Kathy. How are
I've
you?
been so busy, I haven't been able to be on here in a while. I have a few things going on. Number one is my lower back the last few days is achy, and it gives me the impression of like UTI or kidney infection or, you know, something like that. So I don't know what oils would be good for that.
Okay, so a little bit of a UTI potentially. Like, is it achy across? Is it going up and down, or is it just
Kind
like
of
in the
across.
kidney area?
Cross like both kidneys and in between, kind of in the back. And it's not painful. It's just like, what is this? And is it something that's going to progress or?
Okay, let's do a couple of things. Let me look something up here real quick. Do you have any like increased urgency to urinate or frequency?
No,
or...
urinate's about the same. I don't feel that there's less or that I have an urgency.
Okay.
It's only like the last 3 days, maybe it's something new. So I wanted to kind of try to catch it.
Okay. So let's do this. Like if it was a little bit more serious, I would probably have you do Angelica route internally, but I'm thinking that we probably don't need to go down that route. I would do something of this nature. Like I would use something like maybe marjoram on the low back and the
Rubbing
hips.
it on it or
Yeah, rubbing it on, just, you know, you can put in a little bit of lotion or massage oil, or for me, I just put a whole bunch in my hand and then just rub it on meat.
Mhm.
So you kind of be a judge of that. And then on the front side, so that will kind of, like if it's more muscular, that will kind of help. But
It doesn't feel muscular. It feels like it could be an
Yeah.
internal organ. I don't get
Yeah.
a lot of kidney or bladder infections or UTIs.
yeah.
That's
So
just what made me think that.
yeah. So the other thing is, I would say take like just some regular like eucalyptus globulus or you know, eucalyptus polybroct or radiata. Do you have any of those? Any
I have a
eucalyptus?
eucalyptus. I'm not sure which one it is.
Okay. And again, several drops and in with a little bit of lotion, and then rub it on your lower abdominal area below your belly button. Like your belly
the
button
front,
down to
okay.
the front. And that will help address potential urinary tract issues. And so, I mean, I would probably do I mean, eucalyptus globulus would be your best bet. If you don't have that, polybroct, radiata, eucalyptus would be good. The ones that are more lemony probably won't go after it quite as much. If you don't have any of those, you could even just maybe try like bay laurel. But
I have
I'd go
bay
with
laurel and I know I have a eucalyptus. I just don't know which one it is.
okay. So try the eucalyptus first and like 10, 12 drops and then some lotion and then rub it on the lower abdomen.
Can I put it straight on, or I should put it in some carrier oil, or?
I would probably do it with just like a pump or two of lotion. And the reason being, like, you could do it straight on, but like when you put it in a carrier oil or a lotion, it helps it to linger in that area a little bit longer rather than just putting it on neat, which hits the bloodstream and starts to go to other places. And you want it to kind of linger in that area to fight off any particular potential like infection there. And so I would add just like a pump or two of lotion or just a little bit of massage oil. And if you don't have that, just even go in the kitchen, get a little olive oil or something and then
Yeah,
rub
I
it off.
definitely have
And then
that.
just, yeah. Perfect. Yeah, just be practical, but you don't have to go to something special from the health food store. Just make it doable for you so you can just, lay down and relax at night. And hopefully in a little bit it passes. With that, it should knock it out.
And put all three of those kind at the same time, the marjoram, the eucalyptus, or the bay laurel?
I would just use bay laurel if you don't have eucalyptus globulus, radiata, or polybroct. If you have one of the other eucalyptuses, they would work, but I'd probably go bay laurel instead.
Bay laurel then if I don't have one of those. And then the marjoram along with the bay laurel?
The marjoram would be on the back side. The front side would be the eucalyptus. Yeah.
Oh, okay. Back.
Yeah.
Okay. And then I have a couple more things, sorry.
That's okay.
And I am traveling to Washington State next Thursday for the weekend for a retreat. And I'm not vaccinated. And so I'm kind of deciding what oil should I take just to have myself prepared and protected, or if something, if I need something. So what ones would you recommend?
I would take bay laurel. So I start taking a few drops internally every day while you're traveling and also inhale it. Do you happen to have Monarda?
I do, but I'm afraid that I won't have anything there to mask the. I hate the stuff. I used to take it regularly every day, and I just don't know what I would cut it with.
Yeah. If you could take that internally, that'd be great. And even if you can't take it internally, just inhale it like 20, 25 times at a time, especially when you're going to be around a lot of people. Thyme, some form of thyme can always be good.
I think
And also
thyme thuja or yeah. Would that one be good, or should be different?
Yeah. No, that works.
And would I take that internally or?
I would take that internal if you start to feel like a little bit of cold flu kind of stuff coming up.
And the one I kind of went through my oils. I'm going to order some. So I got this cute little pack for traveling. So I was thinking Ravinsara would be one that I should.
Yeah, Ravinsara is a really great one. Lemongrass would be another one. And then I also like to throw in cinnamon with all of this because, again, anti-infectious conditions, and it is a body stimulant. If there starts to be like some diarrhea or something, you could take the cinnamon for that. Even if there's a digestive, an infection down in the gut. And then another one that I always like to throw into the mix while traveling is basil.
I use that for headaches, so I was going to put basil for sure.
Yeah. I think that's a pretty solid little anti-infectious kit for your travel there.
Okay, so put a couple drops in water fairly regularly. Most of this, I don't have to.
Yeah, you probably could just get away with doing one of them. So if you don't want to do the Monarda, do the bay laurel.
Okay. I just don't know what I'd mix it with, and put it in my luggage. It's so stinky.
Yeah.
It's hard, but I was doing it in the beginning of COVID every day.
Yeah. Good.
So, okay. And let me think. Yeah, that should probably do it. So, and then my last thing is I've been a little stressed lately. My face paint has flared up a little bit. You sent me the myrrh. Thank you so much, because I know it's an expensive oil. And I've been using that not recently because I got better. But I find I'm having a little stress. My blood pressure is raising a little bit, and I so don't want to take blood pressure medicine. So then the stress of traveling and not being vaccinated. So I don't know what you'd highly recommend for stress to just keep me in balance.
I mean, you could use marjoram, just inhaling marjoram. Clary sage can be very good. Even like lots of inhalations with basil would also be helpful.
Okay.
Yeah.
And hyssop, you don't think hyssop, or I'm trying to think what.
Not so much for stress. Like, I mean, it wouldn't hurt, but if you had kava, I'd say take some kava to calm things down. But I'd stick with like clary sage, basil, marjoram. Those are pretty straightforward as far as single oils are concerned for stress stuff.
Inhale them all the time, just to kind of okay.
Yeah.
And then as far as cinnamon, I have cassia, and I do have a cinnamon. What I used from Young Living is not yours, and I hate to use anything but yours. So I don't know if cassia is good enough, or I should order it.
Yeah. Cassia will be that works.
Okay.
Yeah.
I think that covers it. Thank you so much.
You're welcome. Have safe travels.
Well, thank you. Yeah, I don't want to be fearful and stressed, but I want to do this. So you got to just do what you do.
Good. Yeah. Good. Safe travels.
Thank you.
And then go ahead, Troy, then Deborah.
Hey, Miss Troy.
Well, first thing is that Kit showed up.
Oh my goodness.
So
Can you
they
hear
told
me?
us that we got a message for those of you that don't know this conversation, is that kid is from like what, 4 weeks ago, 5 weeks ago?
Yeah.
And we just lost it and we resent it, and they told us that fell apart, and we got this letter saying, the contents fell out, and that's hysterical.
Yeah, so it showed up, and so I guess I'll shoot an email to remind or clarify, but I was gonna just go ahead and keep like the incense that was in it, and there were a couple like staples that I'll just go ahead and keep, and if I can maybe just send back
we'll work it out. Yeah, we'll work it out through email or whatever. Yeah. But
okay, great. So that was funny. And then the other thing I wanted to ask about was I have a tooth that I cracked, I think just grinding at night a couple of years ago.
Yeah.
And I went into the dentist and they said, like, let's, it's so bad, we should pull it immediately, do a root canal, put in an implant, etc. And I just I don't know, like, it didn't feel right energetically. And so I got a second opinion. They said like more or less the same thing, that like too much of the tooth was cracked and that I wasn't gonna be able to do anything about it. So I sat with it and meditated. I prayed about it, and I started to try like alternative things to just see if I could buy some time at first. And then it seemed like it just like all of the pain completely went away from the things I was doing and the things my doctor told me to do. And I think I still kind of grind at night. But like 90% of the time, like there's no pain to it. There's occasionally some sensation or some slight sensitivity, but most of the times it doesn't really bother me. I have taken this stuff called Dentitox for a while now, and I've taken like a standard process formula called Biodent, and then just been keeping extra clean, doing lots of things just to keep the mouth healthy in general and everything. But I just wondered if you wouldn't mind, like, scanning it or looking at it, and if you had any other advice. I'm just super, I don't want to pull the tooth or put an implant in or any of that stuff. And so I've just been real hesitant to do anything with it.
Is there an infection there?
It doesn't, I mean, there isn't pain like most of the time. So
Like when the dentist evaluated, were they concerned about an infection?
I think the first dentist I went into, they just instantly said, like, you should go to the oral surgeon, have them check it out. I went to the oral surgeon. He said, yeah, I'll put you on some antibiotics and then you come in, I'll pull it. And if you want to put an implant in, I will. If not, you can just leave the tooth not there. So I took antibiotics, and at that time, like when this first started happening about 2 years ago, it was hurting. But it hasn't really since then. Like, I mean, on like a 0 to 10 scale, like the most pain I have felt in it in the last year or so is like a 1 or a 2 or something.
The thing is always the concern is like infection. And so I would do things just like maybe 2 or 3 drops of bay laurel and some water and like swish it around in the mouth, or clove. Clove is probably your better bet. It does have a pain relieving property to it. It's very good for nerve pain, and for like infections in the mouth, it's hard to beat. And you could do it in a gargle. Like, sometimes what I have people do, it's a hot oil, so it can be a little bit like irritating. So I have people sometimes put it on a Q-tip and like touch it on and around the areas. But in this particular case, you probably could get away with just putting it in a gargle and just gargling with it on a regular basis, keeping bacterial levels down and pain levels and things like that. But yeah, with the tooth being cracked, there's not a lot you can do other than just trying to keep it as healthy as possible. Yeah. You could also alternate with cypress. Cypress, just to detoxify, like keep lymph moving in your mouth, and that you could just rub on the gums. Like I'd rub it just all over. I actually like to take several drops and rub it on the roof of my mouth. But yeah, like try that, see how that treats you.
Okay. All right. Thank you.
Yourself.
And then go ahead, Deborah, and we do have some questions in the chat as well.
Hey, Deborah.
She may not have had a question. It was just unmuted, so I just thought maybe it was. So
I didn't have a question. I'm sorry.
no worries. I just want to
Okay.
make sure.
I think we just
Yeah.
figured that out.
Yeah. Thank you for asking though. Thank you.
Yeah, you're so.
Here we go. Can I get your recommendation for someone who's 40 years old and has been experiencing very heavy menstruation, cramp pains, along with feeling of tiredness, depression, and anxiety? That's all the information I have for this person. Maybe have her use Vitex?
I mean, anytime the cycle is off, you definitely could start them on regular Vitex, and just a couple of drops on the finger and then rubbed into the temples. Like I usually have them do a couple drops, touch the fingers, and then rub it in. If that's not something they want to do, a couple of drops in water and take it internally, but every day. That will help to regulate the cycle, and usually if the flow is too light, it regulates that, and if it's too heavy, it will regulate that. One of the things that you could also augment is clary sage. Clary sage, inhaled, a few drops on the wrist or applied to the abdomen can be also very helpful. Things like tarragon and a little bit of lotion rubbed in the abdomen the abdominal area, like below the belly button, like to the belt line, can help any sort of cramping or something like that. The depression, what was it? Like there was depression and what was
Anxiety as well.
anxiety and depression? Yeah. Yeah, anxiety can be several different things.
Oh, and
Um,
tiredness.
Fatigue, tiredness. Yeah, we don't know any more information, just that stuff. We don't know anymore, just that
was-
information.
yeah. So,
Um,
yeah, that's correct. That's all they know. Yeah.
yeah. You're kind of working with like a little bit of, partial information. And so, there's still things that could be thrown out there. Sages are really good for general issues with the body being out of whack. Different than clary sage, just regular sage, Spanish sage, can be helpful in the treatment of depression. Also like fatigue, where there's potential fatigue, and also the overstimulation of sensory nerves. You could also say that sage is very protective of the nerves or the nervous system as well. And so always a choice in this area. If we knew a little bit more, sometimes with depression, I treat it with like rose or ambrit, or if it's just too much introspection, I would use something like cinnamon. But given the heavy menstrual cycles, I'd probably not use cinnamon. So you might go back to the sage and things like that. St. John's wort is always a potential in the mix for depression. It could help a little bit with anxiety. Anxiety, there's different reasons or different causes. Sometimes it's actually physical, sometimes it's respiratory. And then there's, psychological things like feeling out of control or things to do with the future, things just feeling unstable. And so, tarragon is a potential. Palo Santo is always very good for treating potential anxiety. If they are tending to obsess a lot about things that are going on or might happen or potentials, bay laurel actually could be good for that. And bay laurel would be taken internally, and can be helpful for that. In fact, going back to Troy, I would probably have you take a couple drops internally to help to minimize the grinding at night, and even maybe a couple of drops internally of marjoram, but like separately, even just a few minutes apart. That should reduce the tension in the jaw somewhat. It might not wipe it out completely, but it might, take the edge off, right? And so in this particular case, if the person is really focused or fixated on the future in work or in a relationship, or just the state of what it's like out in the outside world these days, the bay laurel would help. And even potentially mugwort would just be inhaled or a few drops on the wrist, but a lot of inhalation with the mugwort. And that could be helpful as well. So there'll have to be a little bit of an evaluation of what's going on. Sometimes when I'm interacting with people like this, I can kind of pick up on a little bit of what's going on, and I'll fine tune it for them, just because of how they're talking and how I hear their voice, and I can pick up on a lot. So here, we're not having that. So I'm just going to have to throw out some things that you'll have to potentially explore. And if we know more information, we can potentially go through and treat it. But if you don't, that's a good place to start. Always deepening the breath is always good. The thing that I like about Palo Santo and even something like galbanum is they can help with anxiety, but they're also very calming to the limbic system, which sometimes just starts to calm everything down, just calms everything down. And so, again, it kind of depends on what's going on, but those are all great places to start, and you can just start having them work with something and find something that works. I mean, things that are also sedative in nature, kava kava, spikenard, vetiver, even lavender, all of those are potentials, but sometimes we can know that right off the bat, and sometimes you might have to keep playing with something and have it be a multifaceted approach and treat it that way. And it sounds like there's a lot going on, so hard to say just straight up, but good places to start though.
How long to wait in between applying oils topically? Also, how often can we apply baylaurel to the low back?
You could go crazy with the baylaurel. You could do that multiple times a day. If you're doing them in vet, like a massage oil, like I'd give it probably 20-30 minutes in between. If you're doing one with like neat or like in a body tonic, you can do it like 10 or 15 minutes apart or so, sometimes even a little sooner, but
Sorry, I didn't see that. For the previous person, they said, I'll find out more next time I see them in person.
okay.
Good recommendations to start with.
Yeah. That's a good place to start. And if you go with some of those, you could just have them start inhaling something, and if it starts to bring them a little relief, they'll usually say something, and then you can just kind of let them use what's working for them right off the bat. Definitely Vitex though for the menstrual cycle.
Go ahead, Deborah.
Hey, Deborah.
Hi, I just had a quick share.
Mhm.
I played with that miracle herb that you gave us for the weekend. Do you know that?
Oh yeah.
Yeah,
Mhm.
sorry. I can't remember how to say it.
Ashwagandha. That's a big long funky name. Ashwagandha.
I put it on, I went for a really serious, difficult ride today.
Mhm.
And I put it on, my hips were feeling it a little bit, which is actually, I think, my psoas. And so I put it on my psoas and I put it on my lower back and just all in those areas.
Mhm.
I don't feel a thing right now. So
Yay.
I'm thinking it could be your new psoas solution.
Oh,
So
I like that.
yeah,
Yeah, I like that.
so
Good. Good
I'll
for
keep
you.
trying and I'll keep you posted.
Getting ready for Japan.
I am so excited.
When are you going to Japan, by the way?
My flight is 11/8 and the trip starts
Oh, so it's
11/11.
it's coming up here real quick.
Yeah,
Wow.
and
Very nice.
yeah, and the trip's actually like the first day of cycling is 11/11. How about that?
Very nice.
Yeah, so super excited. It's all good stuff.
Yeah, good for you. I think
Thank
that would
you.
be a very fun trip. Very fun trip.
Yeah, just what I've needed with everything that's been going on in my life. So super excited.
Good
So
for you. Yeah,
yeah, thank you.
you're so welcome.
I have Paracelsus, which I like the fragrance, and thought in one of the classes it was for stress. What is it best for?
So it does help with digestive function, but it helps put the body in a more parasympathetic state, which is rest and repair. Good to use at night. I mean, it is still good for spasms and things like this. For stress, I mean, it might help with stress. Stress oils, clary sage is pretty good. Marjoram, spikenard, vetiver, valerian, Litsea, cubeba, even lemongrass sometimes. Basil can be very good for stress. And so, any of those would work, but should be relaxing, should be calming, should be soothing, and it helps to deepen the sleep a bit, but definitely helps your body repair itself. Yeah.
Yeah, go ahead, Kathy.
Hey, Kathy.
Hi, that was actually my question. And I do really want to know more about how to put myself back in the parasympathetic, because I've been really working on this stress issue, because I'm a realtor and some weeks I just go crazy. So when
I bet.
yeah, so, and in the market and my face pain and just stress in general. So
Yeah.
the Paracelsus, and I do like it. For some reason, I'm attracted to it. Would I do it internally at night, or would I just inhale it?
No, I would put like summer drops on your abdomen. Like, you don't want to take that one internally just because it has a lot of absinthium, and good topically, not good internally. It's too potent. And so several drops on the wrist, you can inhale it. And I would actually do it in conjunction, given what you just said with, you're a realtor, you have some pain, you have all these different situations. I would put the Paracelsus on the abdomen and, maybe inhale it a little bit, and then follow it up with about 20 to 30 inhalations of marjoram, and even maybe take a couple drops of marjoram internally. And the thing with the marjoram is it helps to tone the vagus nerve, which is tied to parasympathetic function. And it pulls you out of the sympathetic, which is like stress, like it's fight, flight, and
I live
all
there.
that. And it's kind of rejuvenating. Like it helps to, like sometimes I try to think of words that like would better describe some of these things, because like sometimes I feel like I get a little too like clinical words, like it does this, where I would say it.
Now we're talking marjoram now, right?
Yeah, marjoram, like, and I would do it in conjunction with the Paracelsus. But the marjoram, you could say, kind of helps to lighten the spirit, like, or rejuvenate the spirit somewhat. And when they say spirit, they're meaning like like how you feel, like your emotions, not so much your thoughts, but how you feel. And so I would say in this particular area, that's a very good, like, kind of 1-2 kind of go-to thing. And I'd probably go back to taking a little bit of myrrh internally.
Okay.
It would reduce because part of your stress is also the stress of being in pain. Your body will just have a pain response because of stress.
They seem to be a vicious circle, one's causing the other, and you can't get out of it.
Yeah. So you could augment it, like you could rotate the myrrh with galbanum, like if you want to save the myrrh for just when you're in pain. But I would be doing like either myrrh or galbanum or palo santo, kind of regular. All of it can be internal if you want, and just to keep minimizing the stress from pain. The stress that gets generated by the body being in pain. It will help prevent further pain. The galbanum helps calm things down and lessens the pain, but the reason why we thought about the myrrh for you is, pain can be very transient, it like can fluctuate and everything. And part of what happens with pain sometimes is like it'll be kind of okay, and then there's almost like this rebound that happens where like you feel good and then all of a sudden it will surge. And and that's more of a nerve pain thing. Like other kinds of pain don't do that, but nerve pain will do that. And myrrh is really good for calming down that rebound effect. And so if you find yourself where it's like it's painful and then it's starting to surge a little bit, go to the myrrh.
Just a couple drops in water.
Yeah, 2 or 3 drops. And I mean, there's been times where I've been in a lot of pain where I took like 8-10 drops.
Okay.
And I mean, it was just like, oh God, it didn't make it completely go away, but it made it very bearable, And, because I have like 4 or 5 vertebrae that are all bone on bone. And so like when it gets irritated, it gets really irritated. And boy, that will take me right out of it.
Okay. Thank you.
You're so welcome.
You have a lot of supports on the website. What is a support oil?
A support oil is usually targeting something specific, like their sleep support or memory support. So it's usually a combination of oils that's very specific to a particular function or a particular system that hopes to go through and treat something in particular. So it could be used as like prevention or like a tonic, or in times where there's a little bit of issue or a crisis in a particular system, or there's a symptom that's arising, you could use it to go through and treat that. So try to make it almost so that the name kind of tells you like what it does and how, when to use it, I guess you could say,
Same question, just with Supreme.
Supremes are the same plant from different regions in the world, so like, you take like hyssop, for example. The hyssop supreme is still hyssop, but it's hyssop from Croatia, it's hyssop from Bulgaria, it's hyssop from Spain, it's hyssop from France. There's one. I don't remember if we have a French one still or not, but there's like 4 or 5 different hyssops in it. And so the idea being that they all have kind of different aromatic notes. And so, it kind of gives you a full spectrum that way, but the plant will develop some properties based on the environment that it's in. And so by taking things from different regions, you put it together and it potentially increases the potency by maybe 3 or 4 times because you're taking it from all these different environments. So it's more of a full spectrum version of that plant. Where if you have something where it's just like, lavender is a good example. Like if it's at high altitude and dry versus low altitude and moist, still the same plant, but they are going to have differences. There is going to be nuances that are going to be different. And because of the high altitude, they don't have to use as much heat to distill it. So there's actually even some chemicals, the chemistry of the plant can actually be different. So it's not just the energy or the fragrance, but the chemistry of the end product can be different because of the fluctuations in elevation, for example. And so you take something that's high altitude from like the desert versus high altitude versus like say Kashmir, which is a very fancy lavender that comes out of Kashmir, or a high altitude lavender that comes out of Europe. They're all high altitude, but the environments were all different. And so even with high altitude, they're going to have very different properties. Like if you look at from the point of view of energy, the high altitude that comes out of Kashmir, it's a real deep violet with no blue prawn in it. It's very good for like nervous tension. It's very good for cleansing. It's very good for the nervous system, the immune system, things like this, the psyche, you could say. Then you come to there's a lavender that comes out of Santa Fe, New Mexico. And not a lot. There's just a little tiny bit of it, but there's still some, right? And still super high altitude. I mean, Santa Fe is 7,000 feet, so it's high altitude. For something to be considered high altitude, it has to be 5,000 feet or above, right? So it's a couple thousand feet over that. And so because that it's in the desert, it's actually very little violet prana. It's almost all blue because it's in this hot, dry environment. And so the plant has to produce a different kind of chemistry to be able to survive in that particular environment. And so, you know, you can say like, oh, let's use a little bit of this for a certain kind of thing, but in other situations, we'll use the other one, or, you know, you just mash them all together and put them together, and you get kind of the best of all the worlds in a supreme like that. And so anything that is a supreme is different regions contributing to that plant. You know, sometimes they might be slight variations of like fir, for example. There's some slight variations of fir that we compiled all together, so you get, you know, a full spectrum fir rather than, you know, having to pick and choose which fir to use. And so, yeah. Supremes are very nice. They're usually 3 to 4 times more potent. Some of them are actually even up to 5 or 6 times more potent.
And how about premium?
Premium, is that usually just blends,
Those
or
actually are black label ones.
right? But is that usually blends? I can't remember.
Yeah, usually, yeah. I don't know.
So
Premium, that's not.
premiums are
Well, we have this frankincense premium, which is just a
right.
single.
So it can be either like a super fancy version of a single oil, you know, like we have the Siberian fir, and then there's a Siberian fir premium, which is just a fancy way of saying like it came from a different region. And, you know, sometimes the distillation process is a little different, or it comes out a little different. So it's a little fancier. And also usually premiums are a little bit harder to get, you know, because they're fancy and they're like usually low yield. And then for the blends, like say, you know, we're doing, you know, a protection versus protection premium. It's the same idea, but we use more premium oils to make it, like more fancier oils. And so like sometimes like a protection or one of the angels, I'll do kind of like a normal blend. And then if we kind of cast aside like, oh, let's try to keep it within a certain price range and really swing for the fences as far as effect, and then figure out what it's going to cost afterwards. Those usually tend to be the more premiums. You know, they're usually precious oils involved in making the blends. And so yeah.
It is time. They were saying, and also complexes.
Yeah, complex is usually an oil might be especially good to treat a particular thing, but needs to be augmented a little bit with some other plants, but it's still like mostly the primary way to treat something. And so I usually make that a complex. Yeah. Okay, and so we need to jump over to the other stream. And so join us if you can. It's more of the esoteric version of what we're doing. But next week, we're going to be traveling on Tuesday. So we are going to do Monday night next week, same time, but just Monday. If you can make it, that would be great. And we still have our thing tomorrow night. And then also this weekend is the Stars anniversary. So if you can join us for that, that would be great. And if not, we'll see you maybe next week.